Good morning and welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada, and my co-host today is C.W. Devers, Behavioral Health Clinician at Roots Community Health Center, and we are reporting for the week of September 14th, 2020. As health professionals rooted in Oakland serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you the information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking in 15 minutes every Tuesday morning of every week and to answer your most pressing questions. So please submit your questions in the comments, by direct message, or email to admin@rootsclinic.org. Now, we know that even though the pandemic is worldwide, the effects are very different depending on where you are. So we are here to give you up-to-date information about Oakland and East Oakland in particular. Now, in the county of Alameda, as of September 13th, we have nearly 20,000 cases with a case rate of 1,212 per 100,000 residents. And now I'm going to show you the case rate map for the county, where the darker the color, the higher the case rate. So you can see our East Oakland zip codes of 94601, 94621, and 94603 are the three darkest zip codes in the entire county, with case rates around 4,000 per 100,000. More than triple the case rate for the county overall. Now I'm going to show you the county map of percent positive tests or positivity rate. And as you can see, it looks very similar to the case rate map, with the three darkest zip codes again being 94601, 94621, and 94603. These zip codes have positivity rates of 15 to 16%, triple the county, which is still at a 5% positivity rate. Now this map looks quite a bit different from the others, with our East Oakland zip codes looking a little pale. This is a map showing testing rates. So what I want to draw your attention to here is that those same zip codes with the highest case rates and the highest positivity rates have some of the lowest testing rates. Now this is the opposite of what we want to see. If we have more positives, it means that we need more tests so that we can stay ahead of the curve, identify cases, and slow the spread. We'd like to see this map look like the others, where the zip codes with the most positives also have the most tests. Saying this another way, imagine if we were testing in East Oakland at the same rate that we were testing in other areas of the county. More than likely, we would be diagnosing way more cases and reaching more people who have been exposed, so we could stop the spread that is occurring disproportionately in our East Oakland communities. Now, having said that, we know that unfortunately, poor air quality from the fires has caused testing events to be canceled and testing sites across the county to close for the day or close early. This is a reminder of something that we've mentioned here previously, that the number of cases depends on many factors, including the availability of testing itself, so is not necessarily a reliable predictor of where we are in the pandemic. That's why, in addition to cases, we must look at hospitalizations and deaths. Now, you may recall that there was an increase of cases and hospitalizations after the 4th of July holiday weekend across the state of California. And here in Alameda County, we saw that same increase in hospitalizations between that 2 to 3 week mark after the holiday weekend. Remember, the number of hospitalizations is an indicator that stays the same regardless of tests. It doesn't matter how many tests you do or whether you were tested or not. If COVID is going to send you to the hospital, it's going to send you to the hospital, test or no test. So if we are going to have a post-Labor Day spike, and judging by what we saw over Labor Day weekend, we are bracing ourselves for it, we would expect to be seeing an increase in positive cases right about now. In terms of monitoring the pandemic, again, with the availability of testing having been curtailed by the poor air quality, just looking at cases will not necessarily be a reliable predictor of where we are heading in the pandemic. So if we have a similar spike from Labor Day as we did after the 4th of July, it could present with increased hospitalizations in another 1 to 2 weeks from now, towards the end of September. We are hopeful that this will not happen, but we will be keeping an eye out for that, and so should you. Remember, we are recommending getting tested 5 to 8 days after potential exposure and isolating yourself in the meantime. So if you think you were exposed over Labor Day weekend, now is the time to get tested. Also, keep an eye out for your symptoms. Now, out of the 1,300 positive patients tested at Roots, only 40% had symptoms the day they were tested. So not having symptoms definitely does not mean that you don't have COVID. But if you do have symptoms, that is an absolute reason to isolate yourself immediately. Get tested and continue to isolate until you get further instructions. Now, in the county of Alameda, as of September 13, 2020, we have nearly 20,000 cases and 332 deaths, according to the county dashboard shown here. And what I want to point out here is that for the first time, we are seeing deaths shown for those 50 years and under. And what I want to further point out that we have to keep in mind is that any category with numbers under 10 are not shown on the county dashboard. So when you add up all the numbers here, it does not add up to that total of 332 for that reason. So once we do the math, here's another way to show this. We see cases under 50 years of age. And we will continue to show it this way as long as needed, since it can be misleading and give us a false sense of security to not see any deaths in the younger age categories when in fact we do have them. And we will also continue to advocate to our colleagues at the Public Health Department to indicate, at a minimum, what age groups have deaths. Even if it has to be shown as less than 10, we think that's better than showing nothing at all. So the bottom line is the virus is hitting Oakland harder than most parts of Alameda County, and it's hitting East Oakland even harder. We are beginning to see deaths among younger people from COVID-19. And another thing we are beginning to see is an increasing number of cases being acquired at family gatherings and from interacting with friends and family outside of the home. This graph is showing our top 5 causes month over month as a percentage of the total cases where the most likely cause was determined. And as you can see, contracting COVID-19 from an identified individual outside the home is rising the fastest. Upon reviewing the cases, it is clear that this is happening among family members and close friends who are visiting one another but don't live together. This is especially concerning because we understand how hard it is to follow the guidelines when we're around people we know and love and are familiar with. And we know that culturally, some of the precautions can come off as rude or disrespectful. If you refuse to come inside, or you come in wearing a mask and you won't stay too long, or if you refuse to sit down and have a bite to eat, someone might think you're being rude. If a friend comes to the door and you don't invite them in, or you ask them to step outside to talk, someone might think you're being rude. Like, do I look sick? Or how dare you think I could give you the COVID? But let's face it, if everyone is not sheltering in place all the time, and if you don't live together, then when you come around each other, you are putting each other at risk. And if you are not completely 100% forthcoming about what you're doing and where you may have been exposed, you could cause harm to those same people you are worried about offending. Now that's disrespectful. I understand that it's in our nature to greet, to hug, and to share, to invite folks in, to socialize, and to break bread together. I'm sorry to say, but all of those things that we were raised to do, those things we might have even taken for granted before, those things have to wait right now. In COVID time, it is not disrespectful to turn down a meal or insist that you chat outside. It is not disrespectful to ask that everyone wear a mask. It is actually the greatest act of kindness to go out of your own comfort zone and set boundaries to protect the ones you care about. We also understand that this ordeal has been going on for 6 months now, and some of us are struggling with loneliness and isolation. We get it. There are folks you need to check in on, and that's okay. Take all the precautions you know to take, no matter how familiar you may be. We cannot let our fatigue with this situation allow us to put ourselves and our loved ones at risk. And now, my co-host, C.W. Devers, will review practical self-care techniques while sheltering in place. C.W.?
Thank you, Dr. Noha. Good morning, everyone. I'm C.W. Devers, Behavioral Health Clinician at Roots Community Health Center. Today, I'm going to encourage us to be mindful of our human, social, and self-care needs while being physically safe during COVID-19. An increase in anxiety symptoms is expected. Given the complexity of everything going on, while a healthy amount of anxiety inspires us to stay physically safe, extreme levels of anxiety impacts our overall health. I invite you to get a pen and paper and jot down some notes for yourself and others. If you have any additional tools, please share in the comment box below. If you have a smartphone, tablet, or laptop, I encourage you to explore the App Store. There are free and convenient apps which give you video tutorials. Let's start with taking a look at our daily routines. Does it include self-care? Meaning activities which exercise our overall physical and mental health. These include stretching, walking, yoga, mindful breathing, etc. Type in the word stretching into your app store and you'll be able to find an array of techniques. Please consult with your primary care physician if you have any physical limitations. Does your daily routine include meditation? This could embody mindful breathing, spiritual devotions, working on your hobbies, journaling, etc. Are there any projects you are thinking about working on? Maybe remodeling your home, entrepreneurship, learning how to upgrade your car, reorganizing, exploring new styles, sewing, wood carving, etc. With everything going on, we must take time to clear our minds of anxiety triggers and breathe. Easier said than done, however, not impossible. Yes, we all have pressures to overextend ourselves. Roots has several behavioral health clinicians who are available to assist you with setting and maintaining healthy boundaries. There are no shortcuts to healthy living. Physical distance does require change to social norms and interactions. We are social beings and need to connect with each other. I'm sure you are connected with others who you have limited contact with since March. Some of us remember how people stayed in contact by writing letters. Receiving and writing letters of appreciation uplifts our moods and enhances our feelings of belongingness. Given the global physical restrictions, many are meeting new people on social media and apps. I invite you to type in the word social into your app store. There are numerous of free socialization avenues, and yes, stranger danger is real. I recommend you use similar in-person social precautions when meeting new people over the internet. Give it time. You do not have to give someone your personal cell phone number to interact with new people over the internet. Are you aware of any like-minded community associations? This may be a good time to explore and expand your social network. Get involved and become more familiar with those around you. With the shift of being at home for the majority of the week, many are experiencing domestic conflicts. While quarrels are normal and can be healthy, the compounding stress may result in intensified emotions. When our emotions are inflamed, we say and do things that we wish we could take back later on. Being in a committed union comes with lots of different disagreements. However, one thing we agree upon is not giving up. Healthy and mature people understand sometimes we need an outside person to mediate. A professional, unbiased mediator, primary objective is to enhance the harmony of the union. This could be a spiritual advisor, evidence-based clinical therapist, etc. It's important to know that you have choices. Alameda County has an array of community resources which are available to explore. Give 211 a try or text them at 898-211. If your cell phone area code is not 510, you can call them at 888-886-9960. You may also come to Roots, and we'll have navigators here to assist you with contacting with 211. Each week, we address some of the widespread myths out there and bust those myths with the facts. If there's information out there that you want us to report on, you can let us know by contacting us on Facebook or emailing us at admin@rootsclinic.org. This week, I have 3 myths to address. Myth number 1, going to a therapist means you're crazy. Fact, plain and simple, engaging in therapy doesn't mean that you're crazy. The definition of insanity does mean that you're doing something over and over again, expecting a different result. Many use therapy as a way to make healthy, realistic changes. Myth 2, experiencing a mental health symptom is abnormal. Fact is, 1 out of every 5 adult Americans experiencing significant mental health symptoms. Also, 1 out of every 25 Americans report having a severe mental health illness such as schizophrenia, bipolar 1, and PTSD. Myth 3, people who experience mental health symptoms are unpredictable, violent, and dangerous. The majority of people in treatment are less likely to be violent compared to others. Most of the mental health illnesses are not violent. In fact, people with severe mental health illnesses are over 10 times more likely to be the victim of a violent crime compared to others. Bottom line, taking time to take inventory of our mental health needs is everyone's responsibility. If you like our content, press the like button and don't forget to subscribe. Now back to Dr. Noha for some final words.
Thanks for that, CW. Now, here's our best advice one more time. Each of us is responsible for ourselves, and like never before, we are now also responsible for the well-being of those around us. Each individual can choose to take calculated risks, but please acknowledge that they are risks, and please don't take risks with the lives of others. Don't be offended when someone wants to take precautions around you. It's not that they don't trust you or that they think you're out getting COVID. They are being responsible for their well-being and yours alike. That concludes today's health briefing. Please submit your questions in the comments, direct message us, or send us an email at admin@rootsclinic.org, and we will be happy to address it in an upcoming briefing. Please tune in next Tuesday at 10 a.m., and thank you for watching.